All right, welcome to the AdaptX podcast, where we have conversations with individuals building accessible businesses, advocating for inclusion, or excelling in adaptive sports. Our intention is never to speak on behalf of those with disabilities, but to provide a platform to amplify their voice and share their ideas for a more accessible world. Today, I'm joined by Dr. Swapna Balakrishnan, doctor of physical therapy and currently a PhD candidate in the Mobility and Investigative Neuroimaging lab at the University of Vermont. She has extensive experiences of providing evidence-based care to patients with advanced dementia, stroke, spinal cord injury, and other neurodegenerative disorders. Her current research focuses on the use of wearable sensors to better understand how people with stroke move in the community and stay physically active, which is the reason why we initially connected. So, Swapna, thank you for joining me this morning.
Thank you. Thanks for having me in this podcast.
A
Excited.
lot of people who get into the field of inclusion, rehabilitation, had some formative experience or a specific individual that influenced them to pursue that path. So what initially got you interested in neurodegenerative diseases?
So, my interest in the field of healthcare started very early. When I was about 8 years, almost 8 years old, my uncle suffered a traumatic brain injury, but it is not the brain injury that eventually affected him. It was the bedside, like being in the bedside complications that really affected him. So I was looking for a field where I can support more individuals who had unfortunate experiences as him. So that initially got me into healthcare. But my experiences working in a skilled nursing and long term care facility actually raised my interest in treating or conducting research in the area of stroke.
And you pursued a bachelor's degree in India initially, correct?
Yes, that's
Yeah,
correct.
yeah. And what's the education landscape like abroad in India, and what led you to come to the US for your advanced degrees?
So I after in India and other many European countries, you typically pursue a bachelor's after you finish high school. But I came to the US for higher education. But after working, while I had to when I came with the purpose of education and had to pursue my licensing and get couple of college credits before I could apply for the license, wait for the work permit. So it took a few years to
Yeah.
transition. But my initial plan was to learn more and, get more opportunities to conduct research and be involved in other areas.
Yeah. What attracted you to UVM?
So after working for a few years, at the skilled nursing long-term care facility, I felt like even though I have all these evidence-based tools, there are some systemic patterns that emerge. Like many individuals, although they got physical therapy, which is a service provided, never looked at what happens outside of physical therapy. Like that 1 hour of physical therapy is the only thing we are focused on, but not the 7 8 hours outside of physical therapy, when many of my patients are found to be very sedentary. Or and I also found that working in a skilled nursing facility and providing care in an institution led to a downward spiral of many of my patients. So I felt like even though I wanted best for them, I was not providing the best. So I wanted to learn more and use my experiences to conduct research.
Yeah. Do you think there's a disconnect sometimes between those who conduct research and those who are in the field delivering that care? So, like, how do you intend on using, I guess, your research to help those people who are still in skilled nursing and healthcare to improve their services that they're delivering?
So I did feel that disconnect when I was a clinician, because I felt like many of my patients who are so so your question was like, do you have a disconnect between research and so
Yeah.
I felt like many of my patients, as a clinician, when I read research papers, I many times found that the patients I'm looking at who are in research studies do not necessarily represent the patient population I serve. And sometimes I felt like the needs are not well understood as I experienced in my practical day to day work. So that was one area I wanted to bridge, and therefore I felt like I understand my patients better, and I am more aware of their realistic needs. So I felt like being a clinician as me can better provide a voice for the patients in research. And also I think this bridge that was there actually when I was practicing, it's actually now better because researchers are more vocal about what they are doing and reaching out to the community, and patients are also uh, like they are more interested in research and talking about their lived experiences. And also like there are more platforms like your podcast that talk about people with disability and how inclusion is important.
Yeah. And you talk about that bridge between the research and the clinicians. And there's also, I guess, a bridge that kind of has to be built between inpatient and community. And I think that's one thing that I liked about your research that kind of attracted me to it initially was this idea of, yeah, inpatients obviously an incredibly important and necessary part of the recovery process, but we have to look at the rest. That's maybe 2 or 3 hours a day or a week. We have to look at the other hours that those individuals are more sedentary than their peers. So how do you think community-based fitness centers like mine can play a role in recovery post-stroke?
So like even in the field of healthcare between settings there is a lot of difficulty with transition, but as our patients move from one setting to another and eventually in the community, a good transition is very important, and that's why I feel like interprofessional care is the core of it. Like I feel like professionals communicating and collaborating is extremely important. So when a patient gets discharged from a rehabilitation program, they tend to, within like 21 weeks, they tend to show the lowest rate of adherence to their exercise program. So uh, gyms like yours are very very important, and there is a need for better collaboration between the rehabilitation programs and discharging their patients and community gyms like yours to help the transition so that the patients can eventually lead a healthier life long term.
Yeah. Yeah. I think it requires, like you said, collaboration, communication, and also just an open mind on both sides. I think
Yes,
sometimes physical therapists believe that the work that they do is kind of sacred in some sense and that it can't be conducted by a personal trainer. And obviously there's many things that PTs can do that personal trainers can't do. But I've always found that the best outcomes have been with the physical therapists who are really open to collaboration. And we're always eager to try to learn from them. Like when someone gets discharged from Spalding or a similar rehabilitation hospital, I want to know what they were working on and how I can
yes,
provide a good continuation of care.
yes,
And I'm not pretending to be rehabilitating. I'm just
yes,
serving as a liaison back to recreation. And I hear from some of our clients post stroke and post spinal cord injury how that return to a sense of normalcy and activities and environments that they were in before their injury is really important to them. So I think
yes,
the community based piece can't be overstated. I know in
yes,
some of the research that you sent me, I think the Dr. Sarah Moore paper talked a lot about motivation.
yes.
Can you speak on kind of what you found to be successful for encouraging physical activity for people post stroke?
uh, Basically like in reality, uh, intervening, like like before that, the other problem that you described is not just about the individual clinicians, it's also the whole system and how it is designed, because it's more directed towards reactive care. If something happens, you fix it and then you move on, but the overall attention towards preventative care is lacking, and that is what research like mine is trying to address. And in like before, there was not a platform for, like, the communication channels have really opened up now. It was not the case before. So I think now that we are speaking about it, and the clinicians, like, if they have a platform to better communicate, that helps too. And with regard to patients, like, research has shown that, like, tele coaching and all the other programs where individual, like clinicians or health providers or any other providers, can intervene and keep, like, provide, like, have a communication with the patient, discuss their challenges. Those things really help. And whatever physical activity is there, it has to not be like, do this 10 times a day, and that's not going to work. It has to be based on what the participant patient wants and how it is tailored to their lifestyle, and it becomes a part of their routine versus like a, like, you have to tell them, like, you have to do this, or like having a strict regimen, because that's not going to work, and we know that those kind of programs are rarely successful.
Yeah. Yeah. You talk about the system being one of the barriers as a whole. How does insurance, I guess, because after injury, people have their inpatient stay, maybe an outpatient stay, but at some point they no longer have funds through insurance. I don't know that world quite as well, but I feel like one
Yes.
thing that we can do as community-based fitness facilities is offer an affordable way for people to continue to be active.
One of the major challenges that especially, like, individuals with stroke, uh, as an example, once they are once they can, if they can tolerate about 3 hours of therapy and they can successfully do it, they are typically going to inpatient. But if they can't tolerate that 3 hours of therapy and they need lower hours of therapy, they go into a skilled nursing. uh, Depending on their progress, if they progress, they have a short term stay and they get discharged home to a outpatient clinic. And some, either they get discharged to outpatient and home care, but basically we don't know what happens after they are out. Like, when the home care discharges it, that is where, uh, that is why that is where they lose contact with the healthcare system. And there, that is where I think we need to, like gyms like yours, and we need to intervene. The communication between the patients, the clinicians, and any form of physical activity is all broken. After that, there's no connection. So that is where I think we need to help clients stay in their own community, because many of these declines, we don't know what happens until they visit the healthcare provider or they visit the emergency room. And that is where I feel like that is a crucial time where we need to intervene in some form, and there has to be a channel where clinicians communicate to patients and give them the opportunity to be active, or
Yeah.
provide them the channel that they can proceed after that.
Once someone finishes inpatient, what is the timeline for rehabilitation, and how often are they checking in with a medical professional once they're kind of discharged from that initial rehab stint?
We are grateful for the support of our first show sponsor. Resolution Fitness offers leading brand health club equipment and accessories for residential and commercial use. In addition to traditional exercise equipment, they specialize in adaptive fitness products and wheelchair accessible machines. If you're interested in outfitting your fitness facility or home gym to be more accessible, visit www.resolutionfitness.ca or the link in the show notes below.
So, if they are successful with inpatient rehabilitation, they typically get discharged, and they have periodic contact with they have periodic visits with the physicians. And like, even and those visits depend on between the physicians and the patient. They vary a lot. But other than that, like, there is, we don't know what happens after that, and that is the problem. So
Yeah. Yeah, maybe it's just lexicon, but even when I was phrasing some of the questions earlier, we always think of post stroke or post SCI as recovery.
yeah.
And it feels demotivating to always be in a period of recovery.
Yes.
Maybe it's just maybe I'm just overemphasizing the word that's being used, but I think when one of our podcast episodes talks about turning patients into participants, it's with Sarah Skeels, who has a spinal cord injury, and she just talks about how it's sometimes frustrating for her to return to Spalding and be treated like a patient again.
Yes.
Like, I can imagine that if you have a stroke at 45, 50, you probably don't want to spend the next 30 years of your life focusing on recovery. You might just want to get back to recreation and activities that you enjoy. So I wonder if just how we frame the period of time after and the physical activity that's involved would be more motivating.
Yes, and and I mean there are also other barriers that patients experience in their own level, like community, having a public transportation, and there are many many individuals do not have a caregiver, or they are fearful to go out without a caregiver. So those kind of barriers also prevent them from accessing the care necessary until it becomes a tipping point. And that's why there is a need for all these, for better interprofessional collaboration and collaboration with the patient to see what works best for them and how we can
Yeah.
encourage them to be active.
What do you think is most important for personal trainers to know about stroke? I know it all manifests differently on a case by case basis, but like, can you think of a few things that would kind of quickly improve someone's ability to support clients post stroke?
So I think the biggest thing that personal trainers need to know is to work with the patient and have the exercise programs more tailored, and also many things like going with the patient, checking with them, and making it more personalized to them versus a one size fit all approach. And I think that is the biggest thing they should know.
Yeah. I would imagine that some of the concerns that someone in a position like mine or a profession like mine would have is when things aren't symmetrical or when there's bigger discrepancies from side to side, there tends to be a propensity or a fear of injury. Do you think the risk of injury outweighs the risk of inactivity?
I absolutely. I think there is a need for individuals to stay active. The more active you are, the risk of injury is much reduced. But that fear is what is the biggest barrier. So it's important for individuals with stroke or any kind of disability to just be active, and that always is better than getting fearful and inactivity is worse.
Yeah, it's a negative feedback loop of fear
Yeah.
of physical activity, so reduced physical activity, so reduced physical capacity, and then an increased risk of injury because of that reduced capacity. So
Yeah.
I think even if you don't know where to start, finding an accessible movement option and
Yes.
being more active is a good starting point.
Yes.
So your current research is in participants at least 6 months post-stroke. Can you explain a little bit about what you're looking at from a metric standpoint and maybe what the requirement would be for participants if there's anyone listening that would fit that criteria?
So basically, the problem that my research is addressing is that many individuals who are discharged from rehabilitation programs, uh, they do tend to improve, but the improvement is very slow. And many of the preclinical declines and any kind of functional decline is not immediately identified. That's why many individuals living with disability are at, especially with stroke, are at high risk for hospital readmissions. Earlier, we did not have a way to see what happens once they leave rehabilitation programs. But now, using wearable sensors and geospatial technology, we can actually monitor how patients move in the community, and these way to collect objective data in moving in the community can help clinicians and other professionals have valuable conversations to help stroke survivors understand where in the community they tend to be active, how they can be more physically active. Is the barrier in the level of their individual, or is the barrier the environment or the community where they live in, and how we can help them stay active? And if there is any decline, we don't have to reach the tipping point. The sensors can help us identify if they can start an exercise program, or go to their physical therapist and you know join an exercise program like a gym like yours.
Yeah.
And so because that not only reduces the suffering, but it also reduces the risk of being readmitted to the hospital. My study is basically a small study, and it's like 2.5 weeks. And if anyone is interested, participants can give me a call or email me, and they can. So once they join our study, we ask them to wear 5 sensors during the first week and 2 sensors in the second week. And basically we use their data to identify what patterns emerge, how we can combine activity and monitors and GPS data to see where in the community they are moving. And also we want to determine how consumer wearables that many of the patients are or people with disabilities are already using, how we can use those data to see how accurate they are compared to more research grade sensors that can be used only in the laboratory or a scientific environment. So that is my study, and I would be happy to have anyone who wants to join our study.
Yeah, we'll include all the contact information in the show notes so they can easily contact you and learn more about it. I was thinking, as you were speaking about it, are there wearable sensors that have been validated for patients and populations post-stroke? I think of like a Fitbit or something where the individual likely would wear it on their affected side so they can use their unaffected side to scroll, etc. But then if they're wearing it on their affected side, that arm might not be swinging quite as much during like bipedal ambulation, so then it might not be accurately measuring step count. Just a thought that kind of popped into my mind as you were talking about it. So you mentioned 5 sensors. Are you placing sensors on every extremity?
So like 3 of the sensors go in the one goes in the ankle, one goes in their non-affected wrist, the consumer the monitor, the Apple Watch that we are using in our study. One of the sensors goes in the arm. The GPS sensor is what they will carry in their pocket, so they don't necessarily wear it. So basically the most of the research studies suggest wearing it on their non-affected side, because like you said, they depend on the arm swing. um, but like the GPS sensor is pretty much carried. With regard to validity, the one of the problems is that most of these sensors have been validated among healthy adults or older adults who may not use assisted devices or do not have any significant walking impairment. So one thing that we are using validated sensors, and there is the GPS has been found to be feasible to use. But we are using off the shelf devices. So we are clinicians, and we want to make this research accessible to a clinic or any other uh, any other professionals who work with people with disabilities. So we don't create devices, we are not engineers. So but the Apple Watch, even though it's a popular consumer wearable used by many people, it's not been validated among people with stroke. So we are trying to see how that data compares with research grade sensors that may not necessarily be available to consumers.
Yeah, absolutely. And are you hoping that using the data that you collect that you can prescribe physical activity interventions? Like is there a second step to this? Or what are you hoping to use the data for, I guess?
So basically, many of the research that has been done has focused on providing interventions, or the other problem is they have used sensors that are not necessarily validated. And also the other problem with using wearables is many of the sensors come in the market and they just leave the market. So we wanted to use sensors that have stayed in the market for a while, so it can be translated into something meaningful. But basically our initial step is, we know that wearable sensors have been used to provide interventions, but in order to provide successful interventions we need to better understand what the barriers are. So we are just in the tip of the iceberg and trying to understand how people with stroke move in the community and how we can move forward. Many of this, there have been previous studies conducted with GPS and activity monitors, but those sensors have, we don't have benchmark data for GPS. So we are at a very early point, and we want to create some meaningful, uh, we want to establish benchmark data at some point, and also better understand how the data collected can be meaningfully used. So the data we collect, we plan to continue using it and find ways to tailor interventions, and how we can use this GPS data to better understand the mobility and how they can be held, how they can be used to better help patients with stroke.
Is your study multi-site? Are you incorporating any other universities or?
So basically, our study is 100% remote. So all the study procedures can be conducted online or over the phone. But we our IRB allows us to recruit participants from all over the US. So we will contact patients through our professional networks. But it does not have specific sites associated with it. It's anyone who lives within the US and can speak English. But it can be anywhere, but we don't have specific tailored sites, because it is, if we want to see what happens in individuals' own environment, not necessarily associated with the clinic, but they can take physical therapy while they are in the research study.
What are you most excited about project-wise that you're working on, either professionally or personally? Is there a specific thing that you think, whether it's a development in technology or specific research related to stroke?
So basically, I am most excited about this research because uh, GPS sensors can identify early clinical declines, and activity monitors can also do. When you combine it, you really enrich the type of data you collect. And basically, my goal is to help patients who have stroke to identify early clinical declines before they have to go to an emergency room and seek rehabilitation services, or make lifestyle changes that prevents them from getting readmitted to a hospital. Any way I can reduce their suffering, or I can also help them save resources and be stay active and healthy in their own community. That is my eventual goal.
Yeah. Yeah, I like that ties into what you mentioned before, how healthcare is inherently reactive and it's best to be more proactive. And that's what I've always tried to do at my facility, is just provide a space for people with and without disabilities to coexist and work towards whatever their specific goals are, and try to be a little bit ahead of the medical model and the healthcare model of responding to illness once it already occurs.
Yes.
So whether there's validated studies on whether participants with stroke should do a specific exercise or not, I assume that increasing levels of physical activity and helping them meet the CDC's recommended levels of daily physical activity is going to be a net positive. So the more that we can encourage it and the more opportunities and environments that we can create, the better.
Yes. And yeah, I mean, I also feel like, as you said, organizations should also allow clinicians that space and opportunity to collaborate. I think these changes need to happen at an organizational level as well, because clinicians are already seeing more number of patients. They are already out of time most of the time. Like, they have so many patients to see. So providing that space and opportunity to communicate and have that help in patients transition smoothly is also very important.
Yeah, absolutely. Can you recommend anything that the fitness industry or gyms could do better to support clients with dementia or stroke or other neuro conditions?
Uh, so some of the making their exercises and any programs or any physical activity recommendation more salient or more tailored to what the patient needs are and what their life circumstances are is extremely important. And also trying to reach out to the clinicians, having the patient as a channel can be a valuable asset, because there is always room for better communication, and they may learn things from the clinician and the patient by having conversations, because that can really open up a lot of channels and help the patient participant or patient better.
Yeah. Yeah, absolutely. I just think of like when someone is starting a gym and they might want to start supporting more people with disabilities. A great way to do so would be to reach out to your local physical therapists and physicians who are
Absolutely.
already supporting those
Yes.
populations, because they likely, one thing I hear from medical professionals is they don't know where to refer patients to. They're
Yes.
not confident referring them to specific gyms. So if you make the effort as a personal trainer to educate yourself and improve your knowledge, and like you said, tailor programs, the best marketing is probably to connect with the professionals who are already serving those populations.
Yes.
Yeah. So Swapna, thank you. We'll include a kind of like the inquiry and contact form for the research in the show notes. If anyone is interested, I'll share it with our clients at my facility who are post-stroke and meet that criteria. But I really appreciate this work. Looking forward to following along, and best of luck as you finish up your PhD and defend your dissertation.
Thank you so much for having me. Thanks.
Thank you for listening to the AdaptX podcast. Our effort to amplify the ideas of our guests and create more inclusive and accessible industries is futile unless these episodes reach a larger audience. If you enjoyed our discussion today, please leave us a rating or a review on whichever platform you use. And if you would like to learn more about AdaptX, the course that we teach to health and fitness professionals and the projects that our organization is working on, you can subscribe to our newsletter through our website, www.adaptx.org. Until next Monday.